So we're going to show you guys a demonstration today of the DRX9000, the lumbar system. And then after this, we're going to show you the cervical. You're going to hold this on the front. And this is the pelvic harness. This is how we sort of grip the patient's lower half in order to stretch their lumbar spine. We'll get her all set up here, and then we'll get her on the machine. We use an upper harness to hold the torso in place, and then this pelvic harness is actually attached with a ring on the bottom to the DRX, and that's where the stretch comes from. And then spread your legs just a little bit. There we go. So we just measure this based on the patient's height. So we're just going to trim these up a little bit. Perfect. Make sure it's all nice and even. And that's perfect. And then we'll get you on the upper harness. We'll just put this up and over. You can hold onto these in front. There we go. Let's go ahead and have you walk onto the machine. Go ahead and stand up there. Perfect. So this is the controller for the bed portion of the table. So the bed takes the patient down horizontally. Real tough to, with a patient with a lot of back pain, be really hard to have them crawl up onto a big table like this when they're in a lot of pain. So great design with the DRX to do all this for the patient. Keep the patient as comfortable as possible given how much pain they're likely in. So kind of the fun part here for the patient is, if you didn't grow up in the 1920s and 30s and you ever wondered what a girdle felt like, you will know after getting cinched up. So this goes really tight around the pelvis so that we can effectively pull through the lumbar spine to decompress the disc. And this upper harness actually keeps the patient in place along with the arm poles here so that the patient doesn't slide down as the machine is decompressing the spine. So that all looks great. And how about a little pillow? There we go. Is that better? Perfect. I'm going to slide you down this way just a little bit. There you go. That's perfect. So we've got all that in there, and then we're going to let your legs up a little bit more, a little bit more. There you go, right there. Perfect. And then the straps go through the center of the knee support. So of course, most people feel better to have their knees elevated when their back is hurting, which is part of the design behind the treatment. I'm just going to select myself on here as the patient. So one common probably misconception about the DRX is that, or any traction for that matter, is that you have to pull the spine really hard. We actually get very therapeutic benefits and positive responses as a decrease in pain with as little as 25 to 30 pounds on the selected load. The other thing that's unique about the DRX, which makes it so effective, is we program the disc level based on where the patient's problem is. So if they have a disc herniation at L5, guess what? We treat at L5. If they have a disc herniation at L4, just like a spine surgeon would zero in on where he's going to operate, we're going to zero in on whatever disc is causing the problem, which is extremely important that we always have to have an MRI and at very least a CAT scan or a CT scan to see where the disc pathology is and make sure that it's consistent with the examination of the patient so that we know where to treat the patient. The other thing is we can fine tune this 1 degree at a time, and you can see the strap moving. We can fine tune this 1 degree at a time to get the best patient response. Then everything's programmed in and we hit run. You can see the tension of the belt is adjusting. Now the treatment is starting. There's 3 graphs here. The top graph is the profile that we're trying to do. It's never perfect because there's always going to be some resistance and friction during the treatment. The machine, the computer, is monitoring the patient 16 times every single second to make sure that they're not resisting or fighting the stretch. You'll notice here on the bottom this loading compensation. So there was basically slack in the system, slack in the harness, and it was waiting until all the slack was out before it actually started pulling. Now it's increasing up, trying to match this desired profile. And you'll notice whenever we get to this, the first cycle is just to kind of get all the slack out of the harness system and the straps. And once we go through the first cycle, we're going to shift the patient's hips and we're going to unlock the table. And of course, this is where we're going to start, the patient will start feeling the decompression. So we'll just wait for a second. All right, so it's at its max. With our max load here at 30 pounds, the measured load is right at 30 pounds. And this is adjusting constantly to patient resistance and then the profile. So now that we're going down here to the bottom of the profile, we're going to shift the patient's hips. Good, just relax. We're going to make sure that all the slack is out here. Then we're going to unlock the table. So now we see a little separation there, and there we go. And that's it. So very comfortable for the patient. The patient will typically just sleep or relax during the treatment. And this treatment will go on for 25 minutes. So the treatment is going to pull and relax and pull and relax. It's always going to be pulling some. It's usually pulling at 50% of the programmed max load. So her max load was 30 pounds today, so her minimum load is going to be 15, and it's going to cycle between 30 and 15 during the whole treatment. The reason it's designed this way is so that the patient isn't compensating or fighting against the stretch. The idea is to unload the spine, to decompress the disc, not to compress the disc. If the muscles start fighting the stretch, the treatment will not work at all. And that's why decompression with the DRX9000 is different than any other style of mechanical traction, especially your old school mechanical traction from the 80s. This machine was designed specifically with the patient in mind, and knowing that this patient's spine tends to want to guard the stretch. It wants to fight against it because it's not normal to be elongated. They've designed a system around keeping the patient relaxed, and that's the whole goal of the DRX, to specifically stretch the proper disc, to keep the patient relaxed during the treatment so that the stretch is actually effective, so that we get a negative pressure or a suction in the disc to retract that disc herniation and get the pressure off the nerve. And that's how the DRX fixes your pain. All right, so patient's done with treatment. We're gonna unlatch, I'm gonna exit there. I'm gonna bring her legs up, slip this out from underneath her legs. I'm gonna lock the table. Do you feel like you've been to space and back? We'll tilt her up. Now, when a patient's never been through this treatment before, we can't go from 0 to 100 all in a single day. So it's a progressive decompression. We start the patient out very gently to make sure that there's no exacerbation of symptoms. And then as the patient's spine is able to tolerate it, we increase the weight about 3 to 5, sometimes depending on the size of a patient, maybe up to 10 pounds per session until we get to their max weight. The max weight just roughly is about 10 pounds more than half their body weight. Go ahead and step down. There we go. And then we'll just take the Velcro off. Perfect, I got it. And then if you'll turn that way for me, great. 1 second, don't go anywhere. There we go, perfect. And that's it. That is a lumbar decompression treatment on the DRX9000.